Friends, how are you? I hope you all are good. From this session, we are going to start respiratory disorder. First of all, in this session today, we are going to study what is meant by COPD. Let's begin this. So, in the disease called COPD, we are going to deal with definition of COPD, what are the causes for the COPD, signs and symptoms, types of COPD, which are the tests we are going to help to diagnose the COPD, and we study last that one is treatment. Okay, now we will elaborate what is meant by COPD. COPD stands for chronic obstructive pulmonary disease. The name itself indicating there is something obstruction in pulmonary. Pulmonary means relating with lungs. So there is something obstruction in the lungs is called as COPD. गया कुछ ना कुछ गड़बड़ जरूर है. Next coming for definition. COPD is characterized by airflow obstruction, which is caused by mixture of small airways obstruction and parenchymal destruction in the lungs. सिर्फ दो चीजें याद रखना है. The main basic thing is COPD में एयर फ्लो ऑब्स्ट्रक्शन हो रहा है. ठीक है, ये एयर फ्लो ऑब्स्ट्रक्शन क्यों हो रहा है? इट्स बिकॉज ऑफ टू थिंग्स. वन इज स्मॉल एयरवे ऑब्स्ट्रक्ट हो रहे हैं, another one is parenchymal destruction हो रहा है. Small airways obstruction means it's relating with bronchi and the bronchioles, and another one is parenchyma. So these both things leads to COPD. Next coming for COPD is irreversible. What does it mean? COPD is irreversible means COPD is a condition which can't be returned to its previous condition. The COPD patients can be managed. COPD patients can be managed, but they can't come to their original position. ठीक है? These entities are included in COPD. First one is chronic bronchitis, emphysema, bronchial asthma, bronchiectasis, bronchiolitis. But in this session, we are going to deal only about chronic bronchitis and emphysema. Let's see first chronic bronchitis. What does it mean? Productive cough for at least 3 months each for 2 consecutive years. मतलब क्या बोल रहा है? 2 साल के अंदर एटलीस्ट 3 महीने लगातार कफ होना है. Then only we will consider it under chronic bronchitis. Next one is obstruction in bronchi and the bronchioles due to hypersecretion of mucus. First हम definition में देखे थे. There is something obstruction in the small airways. Small airways मैंने बताया था. Small airways are always relating with bronchi and the bronchioles. So there is something obstruction in the bronchi and the bronchioles. Why? It's due to hypersecretion of mucus. Mucus ज़्यादा secrete होने की वजह से small airways obstruct हो जा रहे हैं. This will come under chronic bronchitis. Let's see emphysema. ठीक है, emphysema is permanent dilation of pulmonary air spaces distal to terminal bronchioles. मतलब सिंपल वर्ड्स में इतना बोल सकते हैं, जो ब्रोंकियल्स हैं उनका परमानेंट डायलेशन हो रहा है. ठीक है, जो सरफेस एरिया था ब्रोंकियल्स का वो परमानेंटली डायलेट हुआ है. किसके अंदर? एम्फाइसीमा के अंदर. And there is destruction of alveoli where gases exchange takes place. Mainly lungs में हम देखते हैं कि O2 और CO2 का exchange होता है. तो जहाँ ये exchange होता है that is alveoli. So there is destruction of alveoli itself. So in emphysema we are going to see there is a dilation of air spaces and one more is destruction of alveoli. With the help of these two images, we are going to study how this emphysema and the chronic bronchitis will affect on the parts of lung. First, we will see in the emphysema condition. Before going to pathogenic condition, we are going to see how the normal alveoli looks like. See the surface area of alveoli. Okay, these are the alveoli. These are the air sacs which are not infected with anything. These are the normal. These are the healthy alveoli. When we compare these healthy alveoli with the pathogenic condition called emphysema, these are the alveoli which are affected with emphysema. You can see the drastic changes. You can see there is a complete dilation of alveoli. The surface area is completely dilated. You have to remember one thing is in emphysema there will be the complete dilation of alveoli or the air sacs, but there is no any effect on air waves. Okay, next coming to bronchitis, as itis indicates inflammation. Okay, bronchitis, there is inflammation of bronchi, and the bronchioles are the airways which are related with bronchi. Okay, when we see the healthy bronchi, when we see the healthy airway, we can see this is the airway, this is the tubular structure, the hollow structure which we seen in this tubular structure is lumen. Okay, we can see the clear lumen here. Okay, when we compare this healthy lumen with a pathogenic condition of chronic bronchitis, you can see this is the inflammation. As itis indicates inflammation, there will be the inflammation of the airways. It's because of infection or else it's because of excess production of mucus. You can clearly see this is the hypersecretion of mucus which leads to constriction of lumen, and the lumen became narrowed. Okay, see in emphysema there is a permanent dilation of alveoli, but in the chronic bronchitis there will be the inflammation of the air waves due to excess mucus production. Understood? In this image also we are going to see both the conditions called emphysema and chronic bronchitis. So this is the healthy lung and this is the bronchus. These are the bronchioles. Okay, these are the bronchioles. These are the healthy alveoli which are not disrupted by anything. Okay, so when we come to emphysema, the alveoli are totally collapsed. Their surface area is totally collapsed due to infection of emphysema. Okay, when we come to bronchitis, you can see this is the green color excess mucus production, and there will be the narrow airway. It's because of excess mucus production the airway become narrow, and the lumen will also become constricted. Lumen will also become constricted. As we come to causes, we can see exogenous type of cause and endogenous type of cause. In exogenous type of cause, first of all we will see tobacco. More you can see more than 80% of patients will suffer with this COPD. It's because of tobacco smoking. Okay, next one is exposure to dust or sulfur dioxide, wood, animal dung, burnt indoor, etc. In endogenous type of cause, first one is alpha-1 antitrypsin deficiency. How this enzyme will help? This enzyme will prevent the destruction of lung by elasticity. It will give the more elasticity for the lungs and alveoli, which will prevent the destruction. As there will be the decrease in this enzyme, will be the more chances of COPD case. Okay, next one is IgA deficiency. As IgA is concerned with immune response, it will help to reduce the infection. It will fight against the infection in the lungs. Okay, next coming for Carter-Jenner syndrome. What does it mean? Carter-Jenner syndrome is a rare but autosomal recessive genetic ciliary disorder. It is a triad of situs inversus, chronic sinusitis, and bronchiectasis. I repeat once, it is an autosomal type of disorder It is a triad of situs inversus, chronic sinusitis and bronchitis. Before going to clinical feature, I let you know about spirometer. It is a type of machine where a person is asked to exhale forcefully. If there is any obstructive disease, person can't exhale forcefully. If he is normal, he can easily exhale. So on the base of spirometer examination, we categorize the stages of COPD. Now we will start clinical features. What are the features we are going to see in COPD patient? Okay, first there will be the chronic cough with expiration. In the definition of chronic bronchitis also we have seen, if there is a chronic cough at least for 3 months for consecutive 2 years, then it will be considered under chronic bronchitis. Next one is dyspnea and tachypnea. What does this means, dyspnea? Dyspnea means difficulty in breathing. With a D you can remember dyspnea means difficulty in breathing or shortness of breathing. Another one is tachypnea. Tachypnea means there is shallow breathing or a rapid breathing when the person will not get enough amount of air, then he will breathe very rapidly. This dyspnea and tachypnea we will see initially on exertion, later on goes continuously. If there is a first stage or initial stage of COPD, this dyspnea and tachypnea will be seen only on exertion. But when the disease goes on affecting, then there will be the dyspnea and tachypnea continuously. Then pursed breathing. This is the technique. Okay. When the person will not get or when the person is not able to breathe easily, then this person will follow this position. Means this is the technique where the person will inhale through nose and exhale through mouth. Okay. This technique will allow people to control their oxygenation and ventilation. There will be the position called tripod position. This is the position where the person will brace his arms on both the legs or the knees, or patient put his hands or elbow on his knees and lean forward to breathe. In this image you can see he is bracing his hands or the knees on the elbow and leaning forward to breathe. This technique will help to improve the respiratory mechanic and improve dyspnea in patients suffer with COPD. See classification of COPD. This COPD is classified on into the 4 stages. One is mild, moderate, severe and very severe. How this classification is made? It's mainly based on FEV1 and FVC volumes. What does they indicate? FEV1 means forced expiratory volume in first second. Then what does mean FVC? Forced vital capacity. Okay, in mild COPD, if the FEV1, the forced expiratory volume is greater than 80%, then it will becomes under mild COPD. Moderate means when the forced expiratory volume is equal or greater than 50%, then it will comes under moderate. In severe, if forced expiratory volume is equal or greater than 30%, then it will be considered under severe. In very severe, if the forced expiratory volume is less than 30%, it is comes under very severe and is very difficult to manage. So now we will see the diagnosis of COPD. How we will diagnose? On basis of certain types of tests which we are going to held based on the volumes or the based on the test we go for diagnosis of COPD. First test which we are going to hold is spirometer test. In the last slide, I have already explained what is meant by spirometer. It is a type of machine where a person is asked to exhale forcefully. If person is normal, he can easily exhale, but he is suffering with any obstructive disease, then he can't exhale forcefully. If during the spirometer test, if we get the forced expiratory volume in the first second is decreased, then we may conclude he may be suffering with COPD. Next one is chest X-ray. With the help of chest X-ray, we can see the diameter or any infection in the lungs. Okay, in this diagram or in this image, this is showing that the anterior posterior diameter is fully increased when compared to transverse. It's because of hyperinflammation of lungs. Okay, next one is alpha 1 antitrypsin deficiency test. This recommended for all patients with COPD regardless of age. Next one is CBC test. It is a simple blood test where complete blood counts we are going to see. This may help to get the condition called hypoxemia, where there is decrease in oxygen level in the blood. Okay, oxygen is decreased in blood. This condition called as hypoxemia. Up to this, we got what is meant by COPD, what are the causes of COPD, what are the types, what are the signs and symptoms, and how we are going to diagnose COPD. Next, we will see the treatment as the COPD. So, to remember the treatment, we use this mnemonic. Okay. C stands for corticosteroid, O for oxygen therapy, P for prevention of smoking, D means dilators like beta agonist and anticholinergic. Okay, with the mnemonic of COPD only we will remember the treatment. C for corticosteroid, O for oxygen therapy, P for prevention of smoking, D means dilators like beta agonist and anticholinergic. Let's see what does this corticosteroid does. First, these decrease the rate of exacerbation and may improve the response to bronchodilators and decrease dyspnea in stable COPD. They are prednisone, hydrocortisone, methylprednisolone, and dexamethasone, etc. These corticosteroids will help to decrease the rate of exacerbation and may improve the response to bronchodilators. The main corticosteroids which are used during the COPD case are prednisone, hydrocortisone, methylprednisolone, dexamethasone, etc. Next treatment, coming for next treatment, that is oxygen therapy. This is the main therapy which we have to induce in the COPD condition, because we have to maintain the oxygen saturation level. So long-term oxygen therapy O2 saturation should be greater than 80% at rest. Target oxygenation percentage is 90 to 93%. But no, you have to note one thing is never give 100% saturation in COPD patients, because it will leads to respiratory drive and develop excessive CO2 retention. Got? Okay. Once again, I will explain. Corticosteroids are the chemical agents which will help to reduce the rate of exacerbation and may also increase the response to bronchodilators. Okay, the main corticosteroids used in COPD cases are prednisone, hydrocortisone, methylprednisolone, dexamethasone, etc. Next one is when we see for oxygen therapy, this is the main therapy which have to given for long term, and oxygen saturation maintenance should be done. Okay, more than 80% of oxygen saturation should be maintained at the rest. The target percent of oxygen saturation is 90 to 93%, and we should not give 100% saturation because it will increase the CO2 retention. Coming for bronchodilators, these are the vital things, are the vital drugs which we have to give during respiratory syndromes or any COPD cases. Based on the stages of COPD, we have divided the treatment method. In mild COPD, we have to give short acting beta agonist and long acting beta agonist. Example, in short acting beta agonist, we can see albuterol, the puff inhaler which is of 90 mg, and long acting beta agonist salmeterol 50 mg of puff inhaler. In moderate COPD, we have to induce long acting muscarinic antagonist or long acting beta agonist. They are clenbuterol, formoterol. See, in mild COPD and in moderate COPD, first in mild COPD we have to give combination or separate short acting and long acting beta agonist. But when we come to moderate COPD, we have to give long acting muscarinic antagonist or else long acting beta agonist. In severe type of COPD, the treatment we are going to give is, there will be the combination of LAMA and LABA or else with inhaler corticosteroids. LAMA means long acting muscarinic antagonist combined with long acting beta agonist, or else long acting muscarinic antagonist are combined with inhaler corticosteroids. Long acting muscarinic antagonists like tiotropium and long acting beta agonists like salmeterol are given in combination form. Macrolide like azithromycin is given to prevent the infection. In very severe type of COPD, long-term oxygen therapy is indicated, as long-term oxygen therapy will increase the mortality rate of COPD patients. Okay, mucolytics like N-acetylcysteine are indicated to break down the mucus. See, to break the mucus, we are giving the mucolytics. These mucolytics can be given in the form of nebulizer or else in the form of IV. Theophylline are also used in very severe type of COPD or in refractive type of COPD. Surgery may indicated if the patient is suffering with very severe type of COPD or else he is suffering with any complication like collapse or very severe obstruction. With the help of surgery, they will remove the collapse part. Okay. The chest therapy is also indicated in COPD. Thank you one and all. In the next video, we will meet with remaining diseases of respiratory disorder.